I thought being a good dentist meant I never had to sell. That if I did good work, then work would sell itself and people would just show up at my door. But I wasn't prepared for the fact that dentistry is sales. And I wasn't ready, and I hated it. If you're a dentist that wants to have a meaningful career that's also profitable, let's walk through how to make sales easy and a win-win for you and your patient. I remember the first time I recommended a crown. It was $1,000. I immediately had the thought, I wouldn't want to pay that much money for something. So I felt uncomfortable. Am I trying to convince this patient to do something? Do I even warrant the value of something that's going to cost $1,000? I just hated the thought of a patient leaving feeling pressured to do something. Here's a lie that I believed. If I just do really good work, the work will sell itself. It felt pretty humble, but it's actually really arrogant. It assumes that patients know what I know, they value what I value, that they can connect the dots on the things that I really haven't taken the time to explain to them. And when patients didn't move forward, I would just blame them or I would blame sales. But avoiding influence doesn't make you ethical. It makes you passive, and your patients will suffer for it. Everything shifted when I recommended a CBCT for a patient, including a radiologist report. They had some minor symptoms that made me a little bit suspicious, but I recommended the image. It was $500. That felt uncomfortable to say out loud, but a mentor of mine had given me permission to lean into the fact that we're providing value and thoroughness through this x-ray. The report came back, tumor on the condyle. We referred them to an oral maxillofacial surgeon, they got it taken care of, and they were cured. I've had patients that have come to me in pain. I recommended comprehensive treatment. They are now out of pain, functioning at a high level, and cured for life. When I have patients who have sleep apnea, I know that they would pay an immense amount of money, way more than whatever I'm charging, to feel rested and sleep well again. I realized that sales wasn't persuasion, sales was advocacy. The word sales often triggers dentists. I'm not a salesman, my work speaks for itself. The greedy dentists out there, they're the real salesmen. They're going to convince you of something. But here's the truth. Influence is what actually leads to people being helped. Because leadership requires conviction. And better conviction leads to better communication. So let's have a reframe. Sales isn't tricking someone. Sales isn't convincing someone. Sales is identifying people's problems, helping them walk through options to find a solution for the problem they're coming to you to help them solve. This is leadership. This is communication. This is influence. So once I realized that, I leaned into it. Not aggressively, not in a manipulative way, but systematically. So here's the exact process that we walk through at my office when it comes to sales. Step 1, we confirm. I want to know exactly what it is that's the most important thing to the patient for that day, and I want to restate it to them. Next, I affirm. I tell them, hey, with this problem that you've had, that you're coming to me for, you are in the right place. Then I do what's called price stacking. This is where I want them to know that there are cheap options, there are really expensive options, and there's options in the middle. So I always give them the cheapest option. Now, this may actually be a really good fix for them, but I also want them to know that sometimes when you go with the cheaper option, it could cost you more down the road. I also want them to know that there are really expensive options. If they do nothing, it could result in a more expensive option down the road. And then I'll oftentimes tell them this is the option in the middle. People like to feel like they're not going the cheapest, but they don't always want to go the most expensive. Offering them some middle-of-the-road options is going to make them feel valued and heard. Next, I actually recommend the treatment. This is where I tell them exactly what I would do if it was my tooth. Then I inform them of all the investments, all the time, everything that's going to be required of them to move forward. And then we do the final move, which is we close. Let's talk about a tool in our office that has been pivotal in helping us with our presentation and our sales technique so that we can help patients move forward with the treatment that's best for them. That is Oryx Dental Software. Oryx makes it super easy to provide a thorough clinical exam and make it easy to communicate with patients to show them exactly where they're at and what they need to get to their healthiest state. They have a step-by-step workflow that makes the exam process easy and will help you become more educated as a provider. And they have visuals and summaries that make it really effective when you're showing patients what is best for their health. If you've never heard of Oryx Dental Software, check out the link below, book a free consultation, and see how they can help you elevate your exam and communication process in your office today. Nobody told me dentistry was sales, but now that I know it is, I'm so glad. Because now I get to help more people move forward with the treatment that's going to benefit them for their entire life. Because sales isn't convincing. Influence leads to better outcomes, and you cannot have effective communication unless you have real conviction. Once you work on your influence, you're going to help more people live healthier lives. If you want to learn more about effective sales techniques that aren't sleazy or manipulative, but actually help people find solutions to the problems they're coming to you for, then stay tuned. We're putting out content every single week on effective communication styles and how to elevate your practice to the utmost of its ability. Thanks for watching. Stay tuned. See you next time.